Welcome to the chapter on cardiology. In the first section, I will be providing a basic overview of the anatomy. Let's get started. For step 1, there are 3 major types of circulations that you need to be familiar with. These include the coronary circulation, the systemic circulation, and the pulmonary circulation. Let's walk through coronary circulation first. This is figure 2.1 from your text, which is an anterior surface view of the heart. The focus here is on the coronary arteries. So as you can see, there are 2 major arteries that come off of the aorta. The right coronary artery, or RCA, and the left main coronary artery, or LCA. The left main coronary artery branches into the left circumflex artery, or LCX, and the left anterior descending artery, or LAD. The right coronary artery branches into the right marginal artery, and 80% of the time, it also branches into the posterior descending artery, or PDA. Let's look at figure 2.2 to see the posterior view of the heart, where we can more easily view the PDA. This is figure 2.2 from your text, which is a posterior surface view of the heart. As you can see, this is the PDA. And right here we have the coronary sinus. And you can also see the left circumflex artery that begins to wrap around the left side of the heart. So when the right coronary artery branches into the PDA, the patient is considered to have a right dominant circulation, which we can see here. Alternatively, the posterior descending artery can be a branch of the left circumflex artery, which only occurs about 10% of the time. And when this type of circulation occurs, the patient is considered to have a left dominant circulation. If you're familiar with where the arteries are, it's not too difficult to know what portions of the heart are fed by the different arteries. For example, you can see here that the RCA feeds the right side of the heart near the right atrium and right ventricle and wraps around the posterior part of the heart, so it shouldn't be too surprising to know that it supplies the papillary muscles of the right ventricle as well as the posterior wall of the heart. Likewise, you can see the LAD. It goes right down the anterior aspect of the middle of the heart, so it shouldn't be too hard to remember that it supplies blood to the anterior wall of the left ventricle and part of the interventricular septum. Finally, you can see that the LCX goes to the lateral aspect of the heart and wraps around to the posterior aspect. So it should be easy to remember that it supplies blood to the lateral and posterior walls of the left ventricle. Okay, let's follow a drop of blood from the right atrium through the coronary circulation. Recall that this is the right atrium, the right ventricle, the left atrium, and the left ventricle. Here we have the pulmonary artery and the aorta. So starting from the right atrium, blood moves from the right atrium to the right ventricle through the tricuspid valve. From the right ventricle, it moves to the pulmonary arteries through the pulmonic valve. After passing through the lungs and becoming oxygenated, it enters the pulmonary vein, which drains into the left atrium. From the left atrium, blood moves to the left ventricle through the mitral valve. And from here, it goes to the aorta through the aortic valve. Recall that just after the heart contracts, the aortic valve shuts, which I'll draw right here, and blood from the aorta moves into the coronary vessels. Draw these just right here at the root of the heart. So blood moves back into the coronary vessels. From here, blood empties into the coronary sinus and ultimately goes back into the right atrium. Now let's follow a drop of blood from the right atrium through the pulmonary and systemic circulation, which is very similar. So again, here we have the right atrium, right ventricle, left atrium, left ventricle, the pulmonary artery, and the aorta. So starting from the right atrium, blood moves from the right atrium to the right ventricle through the tricuspid valve. From the right ventricle, it moves to the pulmonary arteries through the pulmonic valve. After passing through the lungs and becoming oxygenated, it enters the pulmonary vein, which drains into the left atrium. From the left atrium, blood moves to the left ventricle through the mitral valve. From here, it goes to the aorta through the aortic valve. At this point, blood moves through the aorta to all the different tissues of the body. Recall that arteries feed into arterioles and then into capillaries, do cap for short. It's here that gas exchange occurs between the tissues. Oxygen diffuses into the tissues and carbon dioxide is removed. The capillaries then become venules, which is the beginning of the venous circulation, and the venules become veins, which ultimately drain into the vena cava and back into the right atrium. Okay, let's go through a few examples to solidify these concepts. The first question is simple but important to remember. What part of the systemic circulation contributes the most to total peripheral resistance, or TPR? The arterioles. Remember, the arterioles contribute most to the total peripheral resistance. Okay, here's another question. How would an arteriovenous shunt alter the oxygen content in the tissues? Recall that an arteriovenous shunt, or AV shunt, is an abnormal connection between an artery and a vein. So I'll draw that very simply here. This is an artery. Here are the capillaries, and this is a vein. An AV shunt allows blood to go directly from the artery to the vein. Essentially, blood bypasses the capillaries such that less oxygen reaches the tissues. This means the oxygen content in the veins is also increased. Okay, let's do another question. How would the right ventricle appear on an echocardiogram in a patient with stenosis of the right coronary artery? Recall that an echocardiogram is just an ultrasound of the heart, and it can be helpful in viewing how the heart is contracting. I'll draw out a cross-section of the heart so we can see the right and left ventricles. So this will represent the right ventricle. This will be the left ventricle. This is the anterior portion of the cross-section, and this is the posterior portion of the cross-section. Recall that the right coronary artery supplies blood to the posterior part of the right and left ventricles, as well as the posterior part of the interventricular septum. So I'll draw that here. The RCA, or right coronary artery, supplies this part of the heart. The left anterior descending artery supplies blood to the anterior part of the left ventricle and the interventricular septum. So I'll draw that here. The left circumflex artery supplies blood to the lateral aspect of the left ventricle. So drawn here. In this case, there is stenosis of the right coronary artery. So we'd expect to see decreased activity of the posterior part of the right ventricle on an echocardiogram. Okay, let's do another question. Dilation of what part of the heart can cause dysphagia? Remember, dysphagia just means difficulty swallowing. So again, we have the heart here with the right atrium, right ventricle, left atrium, and left ventricle. Recall that the esophagus sits just posterior to the left atrium. Draw it in right here. So if a patient had a dilated left atrium, just draw in little dotted lines to represent that, we could see that it could compress the esophagus, resulting in dysphagia. Okay, here's another question. What vessel in the body contains the most deoxygenated blood? This is the coronary sinus. Remember, the coronary sinus is the large vein in the posterior part of the heart. I'll draw it in on the diagram here. Some of you may have thought that the pulmonary artery contains the most deoxygenated blood, which is a good thought, but it's not true. The heart actually extracts more oxygen from red blood cells compared to other tissues because heart muscle is so metabolically active. Ultimately, this means the coronary circulation contains the most deoxygenated blood. The coronary sinus is the last part of the coronary circulation before blood circulating in the coronary arteries mixes with the systemic blood. Once blood reaches the pulmonary artery, the coronary circulation, which contains very little oxygenated blood, has mixed with the systemic circulation, which contains slightly more oxygenated blood. So blood from the coronary circulation comes through the coronary sinus and drains here, and the systemic circulation drains blood right there. They mix and then they enter the pulmonary artery. The mixing of both types of circulations at this point results in an overall increase in oxygenation of blood. So you can see that the coronary sinus would contain the most deoxygenated blood in the body. Okay, let's wrap up this section with one more question. How would stenosis of the pulmonary artery alter the pressure in the right ventricle, right atrium, and the coronary sinus? Again, I'll draw on the coronary sinus here. Recall that stenosis just means blood has a harder time moving through it. So I'll indicate that here. So blood have more difficulty moving from the right ventricle to the pulmonary artery. Stenosis of the pulmonary artery could be caused by congenital defect, pulmonary hypertension, or other disease processes, but the end result is the same. Less blood is able to move through the stenotic region, which means there's more blood in the regions prior to entering this point. The increased blood in the right ventricle builds up and causes excess blood to enter the right atrium, as well as the coronary sinus. Ultimately, the increased volume in these regions causes the pressure to increase. So increased pressure in each of these regions. And that concludes this section.